diagnosed with schizophrenia, what can be done? How can it be treated? Up to now, there's no consensus of opinion on this illness, be it its etiology, the causes of the disease, or the exact disorders which should be referred to this diagnosis. Consequently, there is no single treatment strategy. Let us talk only about what has considerable evidence at the present moment. So, what is this illness all about? Schizophrenia is known to have a wide range of symptoms. The main ones are the following: a split personality, which should not be confused with a multiple personality disorder. Schizophrenia has nothing to do with the case of Dr. Jekyll and Mr. Hyde. What is a splitting? Any person can be joyful or sad, lively or tired, kind or cruel, but if, for example, a person is grieving, his thoughts are gloomy, the facial expression is sad, the movements are slow, the capacity for work is reduced. It could be someone visiting a grave. A boxer in the ring is, on the contrary, tense, agile, aggressive, active. He has only one aim: to win. Both people in the above-mentioned examples have an integral psyche. Emotions, thoughts, will, facial expression, everything is coherent. In case of schizophrenia, we see no unity, but only weakly related or unrelated components. For example, one can weep after stepping on an ant and at the same time make jokes when learning about the death of his beloved kids. It's the so-called wood and glass syndrome. One can be a talented mathematician and at the same time have no idea of conduct in a society. One can beat his parents black and blue in the evening, and the next morning be unhappy and worried in case the parents don't get fresh buns. It is common characterize schizophrenia, and as a rule, they appear long before the onset of the disease. Autism, which is a loss of social contacts, problems with communicating and forming relationships. Moreover, often social contacts are not only unpleasant, but even painful. Apathy, a situation in which someone has no interest in anything or is not willing to change things. Abulia, an absence of willpower to act or to make decisions. A person can talk about his future plans, but is not able or is not willing to make any effort to put them into practice. Delusion, an irrational and incoherent utterance which does not respond to correction treatment and completely determines one's behavior. No argument is able to make the patient change his mind. This state can be a sign of schizophrenia, but not in all cases. Delusion can be a manifestation of other mental disorders as well. Pseudo-hallucinations. Patients usually mention a talking voice in the head or the inner voice. In contrast to the term inner voice, which is often used to actually denote intuition or premonition, pseudo-hallucinations always come from an outside source. A common example: a person says that the voice is sent out to his head from an antenna installed on a nearby house. However, sometimes patients recognize the so-called foreignness of this phenomenon. Different kinds of thinking disorder are a common symptom of schizophrenia. For example, a loss of logical and intuitive connection between phrases and sentences, words or even letters in a word. There can be an uncontrolled flow of thoughts, a state in which a person is not able to do anything, for example, completing work or even answering questions, because the person's consciousness is preoccupied with this uncontrolled flow of thoughts. Another kind of thought disorder, which is the opposite to the above-mentioned phenomenon, is called thought blocking. It is characterized by a complete absence of thoughts. Philosophizing, an empty and long-winded argumentation without concrete replies to the questions. Philosophizing should not be confused with demagoguery, which is an intentional and voluntarily used method with the aim of avoiding answering the target question. It is widely used in politics, in particular during election campaigns. Different subtypes of schizophrenia have their specific symptoms. For example, catatonic schizophrenia is characterized by an irrelevant and purposeless hyperactivity, which alternates with the episodes of adopting bizarre bodily movements and holding unusual postures with no reaction to external stimuli. Hebephrenic schizophrenia is characterized by an improper childlike behavior in combination with disorganized thinking. Schizophrenia can be either a chronic illness or have an attack-like character. It can happen that a person has just one attack and after that lives healthily for a long time. What can be done? As it was mentioned above, neither the reasons for this illness nor its mechanisms have been fully studied yet. A complete recovery from this disease cannot be guaranteed, but it doesn't mean that someone who is diagnosed with schizophrenia is destined to become a social outcast. It is essential that the doctor establishes and maintains contact with the patient's relatives or friends. Since with this diagnosis a person easily loses ability to properly assess himself, there should be an assistant next to him who could support him at this moment. However, it doesn't mean distrust to the patient. Just as an example, when someone does rock climbing, his safety is ensured by means of a securing rope, regardless of the level of excellence. The same situation is here. The patient needs someone to hold the securing rope. It is true that we don't have a thorough knowledge of schizophrenia yet, but in the majority of cases, modern medications are able to ensure control over the disease. One shouldn't be terrified at the necessity of taking neuroleptics for a considerable period of time. For example, high blood pressure medications, statins, insulin have to be taken for life. With schizophrenia, a lifelong medication is not always the case. Neuroleptics, as all medications, have side effects. Since schizophrenia is not thoroughly studied yet, neuroleptics don't have the same precise effect as, for example, high blood pressure medications for treating hypertension. It means neuroleptics influence not only the affected mental processes, for example, hallucinations, delusion, but they influence the psyche as a whole, for example, concentration, attention, etc. However, nowadays there exist different types of neuroleptics, and in most cases it is possible to select the medication which on the one hand helps control the illness and on the other hand ensures its good tolerance. There are a lot of means of reducing the intensity of neuroleptics side effects. We'll talk about them in one of our next videos. No matter what medications are used to control the symptoms, they don't make a person happy or healthy. That's why, as soon as the disease has been taken under control, it's vital to start thinking about the patient's rehabilitation and resocialization. As it was mentioned above, people with schizophrenia withdraw from society, and the longer this withdrawal lasts, the harder it is to get back. So, any patient's activity, work, hobbies, sport will do a lot of good. Summary. Schizophrenia is a complex and severe disorder which hasn't been fully studied or understood yet. The diagnosis schizophrenia is not a stigma. It can be treated and it needs to be treated. For treatment, it is essential to find a doctor with whom the patient will be able to establish a psychological, emotional, and intuitive contact. It is vitally important. It is a must to have a close friend or relative, just a person who will provide backup. Standard treatment for schizophrenia is neuroleptics. Yes, it is unpleasant. Yes, it takes a lot of time. Yes, the treatment effect is not reached at once, but it is necessary. All the disease-related issues have to be discussed with your doctor in order to achieve the best possible result. In our upcoming videos, we'll take a look at the basics of self-psychotherapy. Subscribe to our channel. The current links are in the video description below.